Alrighty, it is 5:05 Eastern Time, so we're going to kick things off. Hi, everyone. Welcome to the AUA Virtual Career Fair. Before I hand things off to Dr. Kaplan, I just want to let you know that we are going to have time to do a Q&A after her presentation. So if you have any questions, just feel free to post them in the discussion box, and we'll get to those afterwards. So Dr. Kaplan, I'm going to hand things off to you.
Thanks, Sean. All right. I am going to share my screen so you can see my photos. Sean, is that working?
Yes.
Okay. So AUA asked me to talk about the top 5 things that I wish I knew before I started practicing. And you're probably wondering, why the heck should you listen to me? So these are the practice highlights. I finished residency in 2001 in Albuquerque. I went into solo practice, which you could do at that time, and I was in solo practice for 3 years. It was interesting, fascinating, terrifying, all at the same time. Then a number of urologists got together in Albuquerque, and we started Albuquerque Urology Associates. And this was our private urology group practice. And we did that for 14 years. Those were really good years. You know, you're in charge of your practice, knowing what's going on. It's also kind of stressful because the buck stops with you. Then I became hospital employed for about 3 years. And finally, I had a really great opportunity that came up to join the New Mexico Cancer Center. And so this is a multi-specialty group practice, and I've been there for about a year and a half almost. I have been involved in the AUA. I'm the current South Central Section Board Representative. I was in the leadership class of 2011. I was president of the South Central Section in 2015. And I just finished up my term as president of the American Association of Clinical Urologists. So I do kind of know what's going on in the urology world. All right, so the first of the top 5 things that I wish I knew when I started practice was how to code properly. What do I mean by that? So coding properly, this is E&M, or evaluation and management coding. So this is how you get compensated for the work that you do. You learn how to assign a numeric code that matches the time and the effort that you put into a patient visit. And that's, you know, reviewing labs, reviewing external data, things like this. This is how you end up getting paid. Generally, I don't think that this is covered in residency very well, or if at all. I know when I first got out and I realized I didn't know how to code, I was panically calling anybody to give me some information about how to do this. This is really vital for survival in any practice setting, whether it is private practice, employed, or academic. They want you to code properly so that you can get paid. There are also legal ramifications for improper coding. You shall not upcode, you shall not downcode, you need to code appropriately. So what do? I think that this really should be a major focus for you prior to starting a job. I mean, this is that critical. What can you do? How can you learn how to do this? You can take a coding class. AUA has coding classes that you can register for on their website. There is another group of urologists, PRS Network, and they do urology coding. They do workshops in Las Vegas, something else that you could think about. If you end up getting to your job early, you can always work with the office coder, and they can sort of go through a couple of things with you. That's helpful. You can also visit the cms.gov website. This is the holy grail of coding. It's a little bit cumbersome to get through, but there are a lot of answers there. But this is definitely, I think, the top thing that you need to do either as you're finishing residency or fellowship, or right when you get out, is figure out how to code. Surgical coding is a little bit different. You've probably been doing that, when you're entering your case logs, but this is specifically for clinic visits and hospital visits. All right. Number 2 of things I wish I knew, how to understand and negotiate a contract. So you're going to get a contract and they're going to be offering you probably more money than any of us have ever seen in our lives. And you're going to think, this is great. They want me. But I think it's important that you do your research and kind of figure out, what are you worth? Is your contract actually undervaluing you? You need to kind of look at national salary data information and local data. If you're living in a small town, you may not be making as much money as you are in a big city, vice versa. So I think you need to know what you're worth. You don't want to ask for something that's going to be ridiculous in your specific location. Then you need to look at the benefits that are offered in your contract. You're going to have health insurance. Do you have dental insurance, vision insurance, long-term care insurance, disability insurance? Those are things to look at. You need to look at how much vacation you're allotted. That's important. Do they give you an educational stipend for continuing medical education? Can you go to meetings? Will they help pay for that? Really important things to look at, where you are in your career, is maternity and paternity leave. Do they have something set up? How much are they going to give you? How's that going to work out? There are some online resources that you can access to kind of figure out, some of this salary data. You can look at Medscape, because they will periodically publish like physician salaries. For those of you that are on Doximity, so publish salary data. And the MGMA will also publish data. Sometimes it's a little tricky to get the information there. The one thing that I tell you guys is, get it in writing or it doesn't exist. There is no such thing as a gentleman's agreement. If it's not written in your contract, it doesn't work. Get it in writing. It's also okay to ask for things. I mean, if there's something that you want in your contract that it's not there, you can ask for a revision, see if they'll do it. The worst that they can do is say no. So then you have to find a lawyer. I don't think anybody expects us to be able to do this well on our own. The lawyer is going to help you explain the legal jargon in your contract and also let you know what's there. Is there something there that shouldn't be there, or does there need to be something there? How to find a lawyer. If you're in residency, maybe there's somebody through the medical school or the law school, at the university where you are. If there is a lawyer for practice, maybe that can be a help. You can always try and Google people. It's a little sketchy. And make sure that they're specialized in medical contracts. You don't want somebody that does real estate law, looking at your medical contract. They might charge you some money, but this is going to be money well spent. All right, moving right along in my top 5 things. The next thing we need to talk about is how the money works. And what do I mean by that? So how the money works should maybe also be known as know your compensation model. This is probably one of the most critical things for success in any practice. I mean, we've worked really hard. We know what we're doing, and we need to get reimbursed for our time. So understand your model. How are you paid? A lot of people are paid on a straight salary. I think a lot of academic physicians, you get a salary and that's what you get. Are you going to be productivity based, meaning an RVU based, where they look at how much work you do and then that sort of decides on how you are compensated? Things that you need to figure out. Is there a bonus? Like if you're a straight salary person, but you do a bang up job, will they give you money? For productivity based, like if you were at the top RVU earners, is there a production bonus there? So that's something that you need to figure out. The flip side is there a penalty? And I know this sounds horrible, but if you're not making your money, do you need to pay money back? But that has happened to people in practice. The other thing to understand is really, how does your compensation change over time? A lot of times you'll see the flyers that come out and, they're offering you $800,000 for the first 2 years. Well, what happens at year 3 and year 4? what happens to the money there? And also, if you are a long-term employee or member of a physician practice, is it possible to increase your salary? Will you get a raise? And those are things that I think are really critically important to look at. This maybe is not so much for, people that are going to be employed, but maybe so, is to understand how the overhead for the practice is allocated. So those are all the things that you don't really think about when you're a resident, like, paying for your cysto tubing, or paying for the medical assistants or nurses, paying rent, the building, utilities. And I think that's important if you're in more of a private practice kind of setting, to understand what percentage is the overhead, 50, 60, 70, 30, something like that. And then what's your responsibility? Like, how much of the overhead are you responsible for? Because you may look at the balance sheets and say, hey, I am bringing in all this money, but then it's getting eaten up by overhead. So I think that's something else that you really have to understand. If you are able to, see if you can read the monthly financial reports. In most of the larger sort of private practices, independent practices, the accountant should provide you with a monthly financial report. And this is going to help you figure out where the money goes that you bring into the practice. And I think it will make you feel more comfortable with your situation if you understand that. And also, you have the opportunity, talk to the accountant in the practice. I think when you first get there, this is reasonable to do to the practice. What do I need to know? Check in with them periodically, to say, how am I doing? So I think that that's certainly important. All right. Now, the next one of top 5 things I wish I knew were really how to deal with hospice. And this, I think it's critical that you understand your relationship with the hospitals that you work with. Obviously, if you're employed by a hospital, that's a little bit different than if you are working at a hospital providing services. Hospital. I think you need to sort of figure out, what does the hospital expect from you? So, what sort of call arrangement are you going to have? Are they going to have mid-level support for you? What are they going to do about in-house consults? And I think it's critical to kind of understand what the hospital wants out of you. They're not always the benevolent people that we think that they are. They want you to work as hard as you can. You want to have a life, and sometimes those things don't necessarily interact. But if you can get it laid out from the beginning, I think that's going to make things better. And the question is, what can you, is there help on hospitals to cover? Is there a hospitalist service? Are you going to be doing your own admitting? Will they just ICU? And I think those are the things going to make your transition a lot more smooth from, then block. One can hit. You have to wait to block time share a block with your practice? Do you have your own block? Utilize your block, or if you need more block, you need to ask. So, yeah, how that's handled. The next thing is, what kind of equipment in the OR do they have? If you are trained to do, hold up with a certain type of morcellator, whatever, certain type of equipment, what if your hospital has something different? Is that something that you can use? Capital available to help you get new equipment when you're first coming on. If you are a specialty surgeon and you need things to do your things, you've got it at the hospital, or you can that, or that they will be able to, supply you new provider to I think things that make your life a little bit easier, staff affairs, and so really be helpful. Have some the other interests, and I think that the work-life balance is a total myth. This really and truly, I think, is the hardest part of the job. It is virtually impossible to have a stable work-life balance. Like, something is always going to be out of whack. Your cystectomy is not going to be doing well, and your dog's going to die, and your kid's getting an F in German or whatever. And you've got to figure out how you can balance those parts of your life. I think it's important to really set your priorities and stick with them. If you know that family's a priority, then you need to do that. If you are really working on, trying to advance yourself academically, some things may have to go on a back burner. But think about your priorities, think about what's important, and stick with them. You need to really create healthy coping mechanisms to help with the inevitable imbalance. Healthy coping mechanisms, those are things like exercise, talking to friends, playing music, talking to your spouse, whatever. But you've got to figure out what to do to make this work when you've got this inevitable imbalance in your life, and it's going to happen. And above all, I think you need to value your spouse, partner, friends, or family. You need to make sure that you're helping to meet their emotional needs, because you're really going to need their support when your life is wildly out of balance. Other things that I found, this is great. This is the AUA Young Urologist Committee Transitioning from Residency to Practice Manual. And this is available online at auanet.org, and it has excellent information. Obviously, it goes into more detail than what I can give in this fairly brief talk, but you can download that and take a look at it, and I think it has really excellent information. This was not around when I finished, but I think that it would be great for people that are just starting out. So, questions? Let's see if I can get out of here. All right. Here we go. Okay, Sean, are we back?
Yes, so we are back. Like I said, we do have some time for some Q&A. If anyone does have any questions for Dr. Kaplan, feel free to post in the discussion chat. And we'll just give some people a couple minutes.
And really, you can ask me anything. I mean, I might not know the answer, but I can guide you in the proper direction or make it up. Oh, I guess I will stop sharing my screen because that's not very interesting.
All right, so I think you answered everyone's questions.
Okay.
So thank you so much, Dr. Kaplan.
Wait, there is actually something. When is the best time to start your job search? I really think sort of as early as possible. If you can start looking around maybe in, your fourth year to sort of get an idea of what's out there. Obviously there are headhunters, other job sites, job fairs. The other thing is ask your chair or residency director, because a lot of times, you'll meet somebody a meeting and say, hey, I'm looking for an oncology resident or somebody that's done a fellowship. Do you know anybody? And I think it's important, so ask them. It seems kind of odd, but yeah, I think the soonest that you can do that, and maybe sort of at the, middle of fourth year, that would be helpful. Educate them. Capital to run a solo practice from the business side. Well, that is what I did. And obviously things were a little bit different, so I ended up just taking out a line of credit from the bank, which was a little bit nerve wracking. But I think that's probably what you're going to have to do, is go to the bank and say, listen, I'm starting a practice, and work with them that way. Yeah, I think that's probably what you'd have to do. And running a solo practice now is certainly a lot different than it was then. All right, Matthew, getting a sense for practice culture. Oh, yeah, that is super important. When I did my talk before, it was like learning about the practice that you're there. Can you hang out with them in the office for more than a day? Can you, if there's a social event, can you really kind of get to know them? Because I think that is really key, is to learn the culture of the practice before you join. Because if there are people that you feel that you're going to work well with, that's going to be great. If you're getting sort of the heebie-jeebies when you're on this site visit, you probably don't want to go there. But I think just ask questions of everybody that you can, the administrative people, if there are medical assistants, nurses, physicians, physician extenders, PAs, whatever. Ask them, how do you like the job? Why are you working here? Never say anything negative, but just see how much you can get. Okay. How do you foresee increased creep of venture capital? Ooh, boy. So that is also another really interesting thing. Venture capital, I don't know how much longer that's going to continue, so they're buying practices, sort of improving them, and then selling them. And I think that venture capital is, oh boy, it's a sort of double-edged sword. I mean, it's certainly putting money into practices that can help some practices survive. But then I think that there is a lot of uncertainty, so your practice gets bought, it gets improved, and then it gets sold again. And you may end up in a practice situation that is not what you started out with, depending on who's providing the capital, and how often they're trying to turn over the practice to make more money. Yeah, that's an excellent question. So, anything else out there? Sean, do you think that anything else coming through, or do you think we're done?
No, I think that's it. That's all I see on my end. So,
okay.
All right. Well, thank you so much. Thank you all for tuning in. While you're here, make sure to chat with participating employers to learn more about their amazing opportunities and what they have to offer. We do suggest adding yourself to multiple chat queues, and you will automatically be connected with a representative once you are both available. Thank you all so much. Thanks, Dr. Kaplan.
Great. Thank you.